It's my great pleasure to welcome Dr. Richard Stone. Dr. Stone is the Acting Undersecretary for Health at the Veterans Health Administration. Dr. Stone currently directs the Veterans Healthcare System, overseeing the delivery of care to more than 9 million enrolled veterans. Dr. Stone, would you like to say a few words?
Well, thank you. And thank you all for joining us today. And thank you to President Biden and our First Lady for their commitment to military and veteran families. I'm honored to be here with my fellow civil servants and military leaders. And I'm Dr. Richard Stone. I'm a 23-year Army veteran, and I'm a doctor who has practiced actively for over 40 years. I finished my military career as the Deputy Surgeon General of the Army, and I've been running the Veterans Health Administration for the past 2.5 years. Today, I represent very proudly almost 370,000 VA employees who are deeply committed to our mission of caring for America's service members and veterans. Military families are used to leading our nation, and I want to thank you all for setting an example for all of Americans in helping us defeat COVID-19. Your leadership in masking and practicing physical distancing have helped slow the spread of this virus. And we're here today to answer your questions about vaccinations and to help end this pandemic. I also want to focus on our caregivers of our veterans and to ensure that they are healthy and able to continue their important work. We're going to begin offering COVID-19 testing and vaccinations to designated family caregivers of veterans participating in what we call the Program of Comprehensive Assistance for Family Caregivers. I want you to contact your facility's caregiver support coordinator for more information on this important program. Now, I know that there are a lot of questions out there about the vaccine, and I want every veteran and every family member and every service member to know that they should talk to their own medical provider, either at the VA or at an MTF or elsewhere, if they have questions. You know, VA yesterday delivered its 1 millionth dose of vaccine to veterans and employees. I'm looking forward to taking your questions and honoring your service to the nation. Thanks so much for all you do. Thank you, Kobe.
Dr. Stone, thank you, and Department of Veterans Affairs and Veterans Health Administration. We appreciate having a representative from the VA to speak with us today and to the veteran community as well. So I'd like to ask a couple questions submitted by our audience. We've had over 1,000 questions that have been emailed and submitted. And I know the audience gathered here today is also super eager to hear what you have to say. So first question, 1/3 of veteran family respondents who say they won't receive the vaccine report that they aren't doing so because of personal health reasons. So they might be immunocompromised as an example. So what are the current recommendations for immunocompromised veterans and their families?
Well, as Dr. Fauci mentioned just a few minutes ago, immunocompromised individuals are at greater risk of COVID and severe COVID. And one of the things we need to do is to recognize the fact that if you're at great risk, you should be getting the vaccine. Taking the vaccine is a very personal decision, and many of those personal decisions should be discussed with your healthcare provider. But you know, our 370,000 employees who've been on the front lines of this pandemic for the last year have lined up to get this vaccine. Over 85% of VA employees have now had at least their first immunization. It's an extraordinary testament to the fact that we believe it's safe and we're lining up to get it ourselves.
Thank you. That's super helpful information. You know, we're a part of a larger veteran military family community. I was reminded recently by some of our nonprofit friends at places like MOA, TAPS, AUSA, and Armed Forces YMCA, and they ask a lot of questions. One of the consistent questions we get are the fact that many people in our veteran military family community don't receive their medical care from an MTF or even from a VA health clinic, and sometimes they don't live particularly close to those locations either. So how can they access up-to-date information or even sign up to receive the vaccine?
Well, we know that over half of our veterans, half of our our enrolled population live in rural areas, a long way from even our 1,700 sites of care delivery. We have over 215 sites delivering vaccine today, and we'll expand it. But we would encourage all veterans or interested families to go to va.gov. And if you look at that website, if you go to the top, you'll see a site that says, keep me informed, and it'll give you all the information you need. Or go to their local VA medical center or closest VA medical center website and do the same thing, and it'll help keep you informed. We've also been reaching out in some pretty unique ways. In fact, yesterday, we immunized 500 veterans in rural Montana, where we literally flew in the vaccine to that community on a small airplane in the midst of the winter in order to reach veterans and their families. We're working hard to get this vaccine out to as many people as we can. And I'm really encouraged that so many of our veterans have expressed an interest in being vaccinated. We're still getting through our high-risk individuals, are over 75 years old or over 65 years old, depending on the area of the country that you're in. But we're trying to get to everybody that wants the vaccine as quickly as possible.
Thanks, Dr. Stone. And va.gov, sign up for the updates. I actually signed up myself, and I can testify that it works. I'm a combat veteran myself, and I did sign up for the updates. So we really appreciate that's a fantastic way to get information about the vaccine for our veteran community. The next question is really about how family members receive the vaccine. And the question is, can family members receive the vaccine through the local community healthcare provider or at MTF or a VA facility?
Well, family members, unless they're engaged in our caregiver program, will need to go to their local community in order to get the vaccine delivered. And at this time, we have enough vaccine to vaccinate our high-risk veterans, but not the family members. And just as General Place had discussed, we'll need to depend on the commercial or the civilian delivery system to help support that. And so contact your local community health department and see if you can get on the list to be vaccinated. I know this can be really frustrating, Kobe, and there's a lot of people that want this. You know, most of our research shows that as much as 85% of people want the vaccine, and of the people that are concerned about it, they mainly want to see that it's safe before they decide to actually take the vaccine. But the vast majority of them, once they are convinced that it's safe, will go ahead and get the vaccine. And it's why this effort is so important, to just allow people a chance to have their questions answered in this kind of forum. And I congratulate the Red Cross and Blue Star families for really conducting this kind of forum.
Thanks, Dr. Stone. So my dad's a veteran and Army veteran. He's in his 80s, and he recently got his vaccine. But that was the big question until he got it. And the question that he had and so many other family members have is, you know, when do you think your average family member, middle-aged, good health, when can we get the vaccine?
Well, it's the big question. And the question really relates to how much vaccine we have. And we're prioritizing based on risk. And right now, I would tell you, I can't predict exactly when that will be available. What I can tell you is that the manufacturers are telling us that they will continue to increase their production of vaccine as we go through the next few weeks. And it's our hope that as we reach the months of March and the end of March, that we'll see dramatic increases in the amount of vaccine that's available, and we can begin to approach some of the lower risk populations. But what's encouraging is how many people have signed up to stay informed, to call, to talk to their providers and say, where am I on the list? And when do you think this will reach me? That's a very good sign. You know, all of us want to get through this last mile of this pandemic, and it's going to seem like an awful long mile waiting for the vaccine to come. But none of us are going to be able to resume our lives and be able to get out and do the things we want to do until we get to the point of at least 60 or 70% of the American population immunized. How long the immunization will last is something that Dr. Fauci will answer for us. with his team. Until then, our job is to get as much information as we can and then make an informed decision for ourselves and for our families.
Thanks, Dr. Stone. Patience. So it is a long last mile, but we will be patient, and we will wait our turn and continue to provide the safety and secure environment that we all deserve, wearing our masks, washing our hands, socially distanced. Thank you for your time today and your expertise. I know that those that are gathered here appreciate your willingness to share your insights on the vaccine's effectiveness, as well as the rollout within the veteran community. So we'll keep in touch with you and your team in the coming weeks and months, and continue to share important information and updates from the Department of Veterans Affairs and the Veterans Health Administration. Dr. Stone, thank you so much.
Thank you, Kobe.